A wound that does not heal within 3 months is considered a chronic wound. And as the population ages, the number of chronic wounds is expected to rise. We spoke with Dr. Elizabeth Lee of Methodist Hospital in Arcadia, California, about how chronic wounds are treated. But first, she tells us how a wound becomes chronic.
There is a lot of factors involved in someone who gets a chronic wound. Probably the one that everyone thinks of mostly is people who are paraplegic, quadriplegic, they can't move, so they develop pressure points. Because of gravity, your bones are going to put pressure on the skin and you will get a wound, and it's very difficult to heal because they're not moving.
According to Dr. Lee, a wound care specialist can assess the wound and decide on the best treatment.
The difference between your primary physician and the wound care specialist is that your primary physician is the person you will go to first, and they will assess the wound and they may give you some antibiotics or some creams. But if that doesn't work, then you should see a wound specialist because they will look at the wound and know if it needs to be cleaned, debrided, have devitalized or dead tissue removed, and get more specialized dressings involved to get you on the right track to healing. A wound center is a comprehensive outpatient treatment center which involves doctors and nurses and assistants who are specially trained and interested in treating wounds. Wounds themselves is not just one body part, and it really involves the whole situation, where the patient lives, what the patient eats, what the patient does, moves, social situation, who's there to help the patient. And so we evaluate all these things in treating the patient. The wound center offers treatments special for the wound, including cleaning the wound, which we call a debridement. At our wound center, we do involve a lot of surgeons, and so cleaning a wound does stimulate a wound, and that helps you in the healing process. We also are very expert in treating a wound with cultured skin cells. These are new treatments that are becoming more common. We also use a special wound dressing that has a sponge and a pump to drain extra fluid and stimulate the wound, and sometimes patients need hyperbaric oxygen treatment. The hyperbaric oxygen chamber increases the oxygen to tissue in somebody's body that has been damaged and is not going to heal through the normal pathways. So not everybody's a candidate for this treatment. In those patients, hyperbaric oxygen really helps tremendously.
Dr. Lee described the wound center and the team of specialists.
Our wound center team involves physicians who are trained in wound care and hyperbaric oxygen treatment. We have nurses who are certified as wound specialists who do special training, and the benefit of working with this team is that we do a lot of coordination. And sometimes we have to involve other physician specialties, such as orthopedics, and our wound team consists of general surgeons, vascular surgeons, podiatric surgeons, and plastic surgeons. And so we will coordinate a care based on all these opinions to give them the best treatment options. Our wound center team is also geared to educating the patient and their family in terms of how to take care of the wound. A lot of family members will actually clean the wound on a daily basis, and they have to help move the patient or do all these special lifestyle changes to help the patient heal. And by doing this, they also learn what to look out for and what preventative measures to do in order to prevent another wound appearing.